History. A 27-year-old man presents with a 6-month history of increasing repetitive routines. He is now unable to leave the house without undertaking lengthy repetitive checking of locks, taps, and switches. He is taking longer and longer, so that he is often late for work. He is worried about losing his job, as other colleagues have been made redundant. He had a similar episode when he was 18, around the time of his A-level examinations. But that settled within a few weeks, which is why he has delayed seeking help. He wants to know what is wrong with him and what treatment options there are that do not require medication. His eye contact is good. He is anxious and gently rubs his hands together without looking at them. His mood is not low subjectively or objectively. His speech is normal. There are no delusions or hallucinations, and nothing else of note. Questions. What is the most likely diagnosis? What are the treatment options? What are the key points about the therapy you would need?
Let me answer your questions and formulate this case. The most likely diagnosis is obsessive-compulsive disorder, OCD. OCD can take many forms, but in general, persons experience repetitive, intrusive, and unwelcome thoughts, images, impulses, and doubts, which they find hard to ignore. These thoughts form the obsessional part of obsessive-compulsive, and they usually, but not always, cause the person to perform repetitive compulsions, which are attempts to relieve the obsessions and neutralize the anxiety. Often there is a thought about completing an action that is accompanied by a fear that if they do not comply, something dreadful will happen. They recognize that their fears and anxious behaviors are irrational, but they do not stop themselves acting on them. Medication is not recommended as a sole treatment method, but is often used as an adjuvant treatment if the patient is willing. Research has shown selective serotonin reuptake inhibitors, SSRIs, are most effective for OCD. For example, fluoxetine, fluvoxamine, paroxetine, and sertraline are the first line of treatment. But in the case of these being ineffective, clomipramine and others may be tried. Medications sometimes work by reducing the severity of the obsessive-compulsive symptoms or by taking the edge off some of the anxiety precipitated by OCD. Cognitive behavior therapy, CBT, is a tried and tested treatment. CBT helps patients change how they think, cognitive, and what they do, behavior. CBT focuses on the here and now problems and difficulties. It does not seek to look at the past for causes for current behavior and feelings. In this case, he will need to consider how the obsessive thoughts lead to certain other thoughts, sensations, feelings, and actions. CBT recognizes how these aspects interact in reinforcing cycles. It can help change how this man responds to his thoughts and feelings, leading to alternative outcomes and a reduction in distress. CBT can be done individually or with a group of people. CBT can be time-consuming and needs motivation and commitment from the patient. Treatment usually involves 5 to 20 sessions weekly or fortnightly, and sessions vary between 30 and 60 minutes. The problem is broken down into separate parts. It is usual to keep a diary to help identify individual patterns of thoughts, emotions, bodily feelings, and actions. The relationship between these components is explored and techniques devised to help change unhelpful thoughts and behaviors. There is usually some homework or experiments between sessions, and this may include diaries. As an example, response prevention is practiced where compulsions are not carried out, with discussion of thoughts, feelings, actions, and outcomes.